So today we continue with problems that occur with growth hormone, and today we look at the flip side. The other day we looked at situations where we have excess of the growth hormone, and in this context, today we will look at when we have hyperproduction or low productions of growth hormone. So pituitary dwarfism is the condition we'll focus on. So first things first, we just review again the growth hormone concept. We know the production happens from hormones that are produced either from hypothalamus or the pituitary. Now, the hypothalamus produces the growth hormone releasing hormone, which stimulates the growth hormone to be produced from the anterior pituitary gland. In terms of action, we already say that the growth hormone can either act directly or it can act indirectly as insulin-like growth factor, IGF, that is produced from the liver. So the ultimate event generally is that we end up having lipolysis, then we end up having uptake of glucose and proteins into the bone, and therefore we have increase in bone growth, and then we have increase in the muscle mass as a result of increase in protein uptake. So this is basically what I've just talked about, the lipolysis that is increased by growth hormone, the uptake of glucose and protein synthesis that occurs in the muscles, therefore leading to elevated or increased protein uptake, and ultimately we have muscle mass increasing. In terms of the bones, we normally have increased glucose uptake as well as amino acid, or that is protein synthesis and amino acid uptake, and then we have increase in bone mass density. And therefore, as a result, normally we end up having the bone growing up or elongating in cases of children. And then we have talked about the insulin-like growth factor, which is produced from the liver, and it ultimately goes and does the same thing. The only thing that it doesn't do is lipolysis. So therefore, what is pituitary dwarfism? As the name suggests, this is dwarfism that occurs normally, especially from an endocrine disorder of the pituitary. Okay, because we actually have other form of dwarfisms that are genetical and what have you. So this kind of dwarfism, which is pituitary dwarfism, is basically a disease that is caused by a decrease in secretion of growth hormone by the pituitary, or if there's a decreased sensitivity of the tissues that we've talked about in terms of taking up the hormone. So when we have decreased sensitivity, so in this regard, if we have decreased sensitivity in the muscles, in the skeletal muscles, if we have decreased sensitivity in the bones, if we have decreased sensitivities in the adipose tissues, then we also can end up having this problem. So as I said earlier, this is also known as pituitary dwarfism, or sometimes referred to as the growth hormone deficiency. So what are the causes that can lead to this? So we can classify them majorly into three areas. It can be because we can end up having low levels of growth hormone because of congenital deficiencies. Okay, so this can occur in situations where we have genetic disorders that lead to the baby not being able to produce the growth hormone or producing it in low amounts, or it can be because of a genetic defect of the pituitary gland. And then, for example, we end up having hypoplasia or aplasia of the pituitary gland. And in that sense, we will end up having low levels of growth hormone being produced from the pituitary. We can also have an acquired deficiency. This can occur because of things like tumors, traumas, or infections, and sometimes radiation that is done specifically on the pituitary or even on the hypothalamus. Apart from the acquired and the congenital, we can also have peripheral resistance. So the first two, the congenital and acquired deficiency, normally leads to production problems of the growth hormone. But the last one normally occurs because of the lack of sensitivity. So the target cells are not taking up or are not responding very well to the growth hormone. So this happens in certain diseases like the Laron syndrome, and ultimately the growth hormone levels are okay, but it's just the sensitivity to the growth hormone. Sometimes you can hear the term idiopathic hypopituitarism, which is basically we are having low levels of hormones that are produced from by the pituitary, but without any demonstrable cause. So we cannot pinpoint and say which is the reason or what is the reason exactly. So in the event that we have these growth hormone levels being low, therefore we anticipate that we will have a child who is born with low height or height that is not within the normal ranges. So what is the normal range? So normally we would actually regard, for example, for adults, the average height of an untreated patient with dwarfism is normally 143 centimeters, okay, or below. And for women is nothing exceeding 130 centimeters. So these are people who are quite short. For children, it might not be very easy to observe from birth, but as we go along from 3 to 4 years, you'll notice that now, despite the increase in age, we don't have increase or commensurate increase in size as well. So this is normally also coupled with mental development retardation, or sometimes growth retardation, but the mental development is just normal. So that is the main difference between, for example, this kind of dwarfism and sometimes other forms of retardation that are there. Okay. So if you go back and you can see that the patient will have a large head, will have a flat nose, short limbs, wide hands, broad legs, wide feet. Okay, those are some of the features that are expected to be seen. So we can have two main types of dwarfism in the regard of pituitary dwarfism. So we can have a disproportionate dwarfism or proportional dwarfism. So the difference here, so all of them are dwarfs, but the problem here is that in disproportionate, you'll find there's some parts of the body that are shorter than normal, and the other parts that are on average sizes. So for example, you might find that the head or the upper part is normal size, but now the lower part is the one that is abnormal. So this is also called achondroplasia. So achondroplasia is just a form of dwarfism where we have disproportionate sort of torso and limbs. So you'll find like the torso is almost the normal size, but we go to the short limb and you find that that is not the same size. So that is a short size. But proportionate dwarfism, in this case, basically every element is of the same short size. So in this case, you'll have an average small size in everything, both the torso, the limbs, and everything. Okay, so that is the difference between proportionate and disproportionate dwarfism. So this is an example of a famous dwarf called Joyty Amage. So I've posted these pictures here because they are online. So it's not like I'm infringing in any right, but you can see here she actually is together with her classmates. So these are teenagers, and she's the shortest here and the smallest. And actually, believe it or not, this is the husband. So, and actually she's married. Okay, so she has a form of dwarfism that is achondroplasia. As you can see, no, the shortness or the small size is not proportionate all through. So how do we diagnose this? So obviously we want to look at the growth hormone levels or the insulin-like growth hormone. So we anticipate that this will be low, and also the receptors. So if we have a serum IGFBP3, which will be low as well. So these are indicators of low growth hormone in the body. Imaging results can also be used, for example, just images of the pituitary to see whether we're having tumor, so an MRI or CT scan of the head. As well, thyroxine and thyroid stimulating hormone levels should be checked because this can also affect the rate of growth, because growth is not only handled by growth hormone, it's an amalgamation of different hormones, including the thyroid hormones as well. So for treatment, if it has been ascertained that the issue is low growth hormone, then low amount of growth hormone, then we can give an analog for growth hormone, which is somatotropin. So this is a synthetic form, and this can at least help. Okay, but now it gets to a point that even if you give, for example, for a case where it started quite early and the child has already grown in age, so even if you give later on, the dwarfism is already established. So maybe what you might be doing is helping in other functions of growth hormone, like maintaining the bones and all that. So surgery can also be done to remove a pituitary tumor, which we said tumors are some of the causes. However, some of these things have complications like diabetes or edema or even intracranial hypertension, together with other problems like carpal tunnel syndrome and gynecomastia. So all these other things can develop because of the treatment option, especially like when you're giving growth hormone replacement therapy. So thank you so much for staying with us.